Good afternoon and welcome. My name is Dr. John Huey, and welcome to I Stand Corrected. I'm a chiropractor in beautiful downtown Tarpon Springs at Tarpon Healthcare, and my guest today is none other than Dr. T.J. McNichol from Bay Regional Urgent Care in Palm Harbor. We're going to talk to him about his past, his present, and his future, and I'd like to welcome him and have him introduce himself. So, T.J., tell us about yourself, and welcome to the show tonight.
Thank you for having me. I'm a physician that owns an urgent care in Palm Harbor, and been doing urgent care for about 15 years now. And I've started working in the urgent care business in the Villages, Florida.
Right, I remember saying that.
And was working for a clinic up there for a good 5 years, and worked under a doctor named Ray Dominic, who basically showed me the business of urgent care, and went through a lot of growth there, and just made the opportunity for myself in 2018 to open up my own facility here in Tampa area, and specifically Palm Harbor. And have been open for 5 years now.
Okay. I think I met you right when you first started. We ended up getting together. I come to your office. I think I came to your office, right, to pay you a visit one time.
Yeah, we both met up there.
And I was always looking for a great resource in my area to send patients to, and you've ended up being a fantastic resource. So I really appreciate that. And so
absolutely.
Patients. And we kind of hit it off well. We decided to bounce some business back and forth, which I appreciate. And a question: where from originally? And give me your background as far as your scholastic and.
Oh yeah, sure. Originally born in New Jersey, lived there, grew up there until I was 10 and a half. Then moved to South Carolina and did most of my high school and middle school and high school in North Carolina, just outside of Winston-Salem. And that basically got me to University of North Carolina at Greensboro. Did 2 undergraduate degrees there, one in biology, one in exercise physiology. And then after that, decided to go into medical school. Went down to the American University of the Caribbean, which is on the island of St. Martin. Was there for 2 years during the book work, and then did my clinical rotations up and down the East Coast, a couple stints in New York City, a couple stints in Baltimore and Hopkins hospitals, and another one in Knoxville, Tennessee. I did a elective in surgery there, and that what got me to my general surgery residency at University of Tennessee in Knoxville. Okay. Spent my time there, and then as soon as I got out of my residency program, I decided I wanted to move to Florida and not do general surgery, surprisingly, anymore. It just wasn't the lifestyle that I wanted to live, being on call all the time, and you had to work, live to work, not work to live. So different lifestyle reasons caused me to make the switch into a primary care / urgent care role. And that's when I got paired up with Ray Dominic, as I spoke of earlier.
In the village. Okay, cool. Mm-hmm. Yeah, my niece is doing that now, general surgery and UCLA, and it's a grind, and it's... So that's good. I'm glad you did. Otherwise, we would never have met. If you're still in New Jersey doing general surgery, you would not be down here. And I'd be at this desk by myself, which would be very awkward.
That would be awkward.
So tell me about you're down in Palm Harbor by Alt 19 and Alderman. If you're at that intersection, it's just to the northwest of the intersection, the gray buildings there. And he's at 2815 Alt 19 in Suite B. So nice location, obviously, and you're there 7 days a week?
7 days a week.
7 days a week. Sun up to sunset?
Not quite that bad, but 9 a.m. to 5 p.m., Monday through Friday, 9 to 1 on the weekends, just simply because I am there 7 days a week and I need a little time in the afternoons for myself.
But because you are married and want to remain that way.
Yeah, I would like to remain that way.
Yes. How many years have you been married?
We've been married 9 years.
Okay, very good. You don't have to look at your ring like I have to do. I have it stamped in my ring. That's important. So I've been to your clinic, obviously, blood facilities, x-ray facilities. You got staff to take care of people. What do you enjoy most about doing urgent care right now?
I got into urgent care because of the variety of things that you see, and probably because it reminded me a lot of general surgery. It's very similar, doing trauma up in the University of Tennessee. Every person that walks through the door is a different case, and so that's a lot of what I enjoyed doing. But unlike the general surgery part of it, where you only have a brief moment with the patient, the urgent care business allows me to spend a lot more time with them, get to know patients, have repeat business, and see patients again and have follow-up.
And they're not unconscious.
And then they're not unconscious. They're actually awake, which they're a lot more pleasant to talk to.
That's good. Had another question there regarding, as far as ages, you take what age patients?
I pretty much will take just about any age. I would say from 6 months to onward.
Yeah.
The early, neonates and that sort of thing, I leave for the pediatricians because that's a little bit different.
Well, that's good. That's good. And so you've been there since 2018. And you have staff. How many staff do you have currently? Two staff. Okay.
And that's growing literally as we speak.
Yeah.
So
all right, well, that's good.
We're going to probably go to 4 here in the next week or two, and add a practitioner as well.
Nurse practitioner and another doc. Yeah. Oh, that's exciting. That's going to be more stressful for you, but that'll be exciting.
Right.
And so fun-wise, a couple more questions before we go back to the business. You play hockey. That's how I think I first met you as far as providing care for him, because you're a hockey player. And hockey players are somewhat insane. And they like to smash into boards and do things at high speeds. And as a result, sometimes there are aches and pains. How long have you been playing hockey?
That's a little bit of a tricky question, because I started playing when before I went to medical school, and then I had obviously studying and what not to do during medical school and residency, so I had a brief break. But I started when I was about 22, believe it or not, which is a late bloomer, especially being a Northeasterner. You would have thought that I started earlier, but no, got into it when I lived in North Carolina. Played on a few men's teams there, and then went to medical school, and then started playing.
And you're
again.
playing now on a men's league as well?
Correct.
Now, did you find that you said you did your undergraduate in exercise physiology and your experience with that? You enjoyed doing the sports aspect in your clinic as well?
I do.
Sports injuries, yeah?
I do.
Okay.
As you well know, I currently take care of the players and caddies at the Valspar Championship. So I really enjoy, especially, I play a lot of golf as well. So I enjoy getting to work with those high-level athletes, as well as amateur athletes as well in the area. Very popular retirement community, and golf is quite popular here. So I definitely see a lot of those injuries, and
it keeps you busy.
Keeps you busy.
Yes,
keeps you busy.
There, and we encourage you to go out there and bend down and twist and hit the ball incorrectly as often as you can, because that'll keep us both busy. Anything else you want to say about the business itself, as far as insurances you take, challenges you've noticed now with medical profession and insurance, perhaps? Anything you'd like to delve into?
Well, the insurance business side of medicine has been a struggle, almost from day one. We are constantly getting denied claims just by a code that's been placed in the wrong spot or whatnot. So as far as that's concerned, from a patient perspective, and maybe people that are out there listening, if any physician for that matter sends you an invoice and you think that it could be very possibly a billing error or coded wrong or whatnot, then obviously let the practitioner know.
Yeah.
Because that does happen. It just gets slipped through the cracks, especially in the software that I have that does it all for you. And one would think that it's done right in the software, but sometimes there are glitches that occur. And so that's one problem and that we do encounter in medicine. But as far as the insurances that we take, we pretty much take all of them, minus United Healthcare. For one reason or another, United Healthcare will not put us in network. If anybody is out there from United Healthcare, please put me in network. Okay. You know, I mean, I've been trying for 5 years, and they keep denying me, saying that there's too many urgent cares in your area that are in network.
Okay, we want to discuss that too, because there are hospital-based now urgent cares. I think even TGH has one on 19. Advent has one. I'm not sure who the other ones are, but they're all kind of hospital-based. I think it's maybe Baycare has one as well. So those are competitors of yours, obviously. So what kind of sets you apart that people want to see you? Because obviously you're a personable guy, you care about your patients, but what else sets you apart with respect to those type of other centers?
Sure. Well, as you just said, in my clinic, you'll get more of a personalized experience. A lot of those hospital-based urgent cares, they are staffed with 20 or 30 different physicians throughout the month. So if you have to go back for follow-up, you're going to see a different person each time. I do know that a couple of them in the area don't do the labs on site. You're sent to a lab to get it done, usually in their network, in their hospital network.
And you do labs in-house.
And we draw them in-house and do everything there. But it's very difficult for clinics like myself to compete against these hospital-based urgent cares just because they have unlimited budgets. And one other thing that does separate my clinic from theirs is we do more than just urgent care. They do only urgent care. We do pre-ops, and we do
explain pre-ops for people that don't know what that.
Okay, so for somebody who's going under general anesthesia for a surgical procedure, most of these surgeons these days are requiring that they get cleared medically before going under the knife, so to speak. And so we do those pre-ops within 24 hours. They get cleared, which is unheard of for the most part. We're the only clinic that pretty much does it within 24 hours.
I think your point about maintaining continuity of care with the same physician, that is something that's highly underrated. You've got medical complications and medical errors, medication, I should say. So if someone gets a prescription from Dr. Smith and then 4 days later has to go back to the urgent care and gets it from Dr. Jones, that can complicate things. But if they got one doctor talking to and dealing with, there's definitely an advantage. I hear that a lot with patients, especially now, certain, I won't name the insurance companies or the healthcare entities, but they're dropping their primary care docs like flies. They're just changing them all the time, and that never leads to better quality of care. So, full disclosure, I've used Dr. McNichol personally, and actually sent my kids there, I think, too, from time to time. Yes. So I do trust this man. That's important. You got to trust your physicians and make sure that they have your best interest and are able to take care of you as he has for me and my family and a lot of my patients. So. You'd like the sports injuries. You also treat patients who have had the unfortunate incidents of motor vehicle accidents as well.
Correct.
Tell us about what goes on there.
I do see a lot of patients for personal injury involving auto accidents. And without getting into a tremendous amount of detail, the There's a law in the state of Florida that says that a physician has to see correct me if I'm wrong, see a patient within 14 days of an accident so that a evaluation is to be performed and a determination of whether the patient has what is called an emergency medical condition or not.
Right. Yeah, if they don't, that, for those of you not aware of that, if you have an accident and you don't see someone like Dr. McNichol in the first 2 weeks, then you will not be able to use your health portion of your auto insurance. And normally it's primary. If you're unfortunate enough to have an accident, it's your primary insurance. It's primary over major med or Medicare, even workers' comp. But if you don't see him within 14 days, then you're going to be stuck with your regular insurance, including all your deductibles and co-pays and all this. Also, restricted ability, especially if it's a workers' comp claim, to see the physicians that probably would serve you best, because that's always a nightmare having a workers' comp claim in the state of Florida still, unfortunately. Well, that's good to know. And other resources that you like to use in the area as far as physical therapists.
Sure.
And tell us about that as well.
Well, I'm glad you brought that up, because there's one thing that I've always wanted to get out there, and that is this competitiveness, if you will, in the medical field in general. And what I'm speaking of is, there's the osteopathic guys that are saying, oh no, the Western guys, they don't know what they're doing. We know what we're doing better. So, and then there's the, Western medicine guys that are going, oh, I'm not going to send my patient to a chiropractor. They're not, blah, blah, blah. And there seems to be this competitiveness, or sometimes animosity, really, where a Western, traditional Western trained physician will just outright refuse to send a patient to a chiropractor like yourself. And, it seems to go across all of medicine at some level. And, what people and other practitioners need to learn or understand, in my opinion, is, at the end of the day, it's all for the patient, right? It's all for the patient. That's what we're here for. And just because you've been trained in one particular area doesn't mean that other area doesn't have something to offer. And it goes always, right? So, I think it's very important to, and here's my example, okay? I had a neck that I woke up one morning, could not even move it to the side. It was just stuck in this area. It was so painful. And I took prednisone, I took muscle relaxers, I did all my Western stuff to no avail. At the time, I was working for Dr. Dominic, who is also a chiropractor in addition to an MD. He said, no problem, put me on his chiropractic table, did his adjustment, and then all of a sudden, I've got full range of motion. At that point in time, I was a believer in chiropractic medicine. So I just think that more physicians, especially Western trained physicians, need to get on board with chiropractic medicine. Has a lot to offer in addition to what we do. If we work in conjunction with one another, then that just creates better care and health for the patient.
Absolutely. I think rowing in the same direction makes it better for the patients.
100%.
I've never heard that story before, so I like that. I like that story.
It's true.
And certainly in 2013, as opposed to 1991 when I graduated, things have gotten a lot better. So things are moving in that direction. There are occasional holdouts here and there, but
Sure.
I'm sure they'll see the light sooner or later.
Or retire.
Hopefully retire. But it's a point well taken. Anything else you want to tell our viewers here about you personally, or about your clinic? Do you want to hit the highlights as far as
Yeah, the highlights is pretty much we do just about anything you need us to do.
Yeah.
I see patients on a primary care level. I see patients on an urgent care level. I see patients on I just need to come in and talk level. So, we're here to support the community, provide the best care for our patients that we can. And hopefully longevity, right? Be here for a long time.
I think that there's an issue with my Y chromosome patients, men obviously, who are not good at making appointments for their primary care docs because they got to set the appointment and they got to keep the appointment, and it just seems like too much of a hassle. So what I've done and since we met is there are guys that need a primary care doc, and if they're going to see somebody once a year, you've been able to handle that role because it's not an onerous process for them to set the appointment to come in. That's a walk-in. If you're there, you take care of them. There's no pressure on them to show up at a certain time. So I think guys really like that because we're just difficult.
They can walk in at any time.
Difficult that way. So I encourage you out there, if you don't have a primary care doc or you haven't seen in 24 years, then give Dr. McNichol a call and make sure you go in there and see him, because he'll be able to do all the things that your primary can do as well, but without all the headaches that you may have, perceived headaches that you may have getting back into your primary care, or if it's changed a lot because like I said, the insurances are changing, the primary care docs are being dropped, and then as a result, there's I don't know who my primary care is right now.
Yeah, I've had lots of patients who have come in, especially of late. I don't know why, that all of a sudden their primary care doctors shut their doors. Yeah, they're moving to South Florida. They're moving to this state or
VA.
Yeah. So if you can come see us at any time, and that's another thing is new patients that are coming into the area, the wait for a traditional, if you will, primary care doctor is usually about 6 months for a new patient, where you can get us the same day. And then the other thing is when you come in to see us, we're not going to send you all over creation to Quest for labs, to here for that radiology. We do it all in-house.
Yeah, so which is excellent. So address, phone number, website, you'd like to give us that information one more time?
Sure. The address is 2815 Alternate 19 Suite B here in Palm Harbor. Now, if you are going to Google Map that address, make sure you put in Bay Regional Urgent Care. For some reason, people who put in the physical address, 2815 Alternate 19, it brings them to Dunedin.
Really?
I don't understand it, glitch in the system, but it does. So if you're going to actual Google map it, put in the name of the business.
Okay.
Our phone number is 727-303-3111. And if you need to email us, it's BRUC for Bay Regional Urgent Care at bayregionalurgentcare.com.
Okay, good. That's good.
So nobody named Bruce works there. We get that all the time. We tried to email Bruce. No, it's BRUC. No E.
Bruck.
That's
what email to Bruck.
Yeah.
So if you're driving on Alderman, you would take Alderman to Alt 19 and then go across that light, make a right further north, and you'll see the flashing sign there, that's the open sign, which is open quite a bit. Well, I want to give the opportunity to say anything else you want. We have another minute before I'm going to close things up here. We talked about your location, patient ages, your ability to act as a resource and take care of their blood work if you need be, x-rays if you need to. We have some good places in Palm Harbor to do MRIs as well, and Tarpon Springs as well, so that's kind of handy. And I can speak from personal experience out of my patients. He provides excellent care, available, at the off times when bad things can happen. When you have a fall or a spill, it's not always on the schedule that we'd like, and as a result, being able to come in at odd times is a benefit, obviously. I want to thank you for being here, Dr. McNichol.
Thank you for having me.
And as far as what's going on in Tarpon with Tarpon Total Healthcare, we've got some events coming up On the first Friday in July, which is July 7th, we'll be having our Canine Partners for Patriots. This event was canceled last month, or I should say earlier this month for the first Friday because of inclement weather, and we're hoping very much so that we have good weather on that Friday. It's also the first Friday, so parking will be a little bit hectic. We're having vendors at that event for the fundraiser, and all the vendors will be veteran-owned businesses, which is kind of cool. We're selling tickets for different raffle prizes. All the money goes to Canine Partners for Patriots, which is a fantastic organization. I found out after we had set this up, one of my patients about 9 years ago used a dog and was able to, it made a huge impact on his recovery from PTSD, which is basically what these animals are for. So it takes a lot of money to train these things. So that's going to be on Friday, July 7th from 6 p.m. to 9 p.m. So you can reach us at our website, which is going to be at TarpmanTotalHealthcare.net. Check us out on YouTube, Instagram, and I think Twitter as well. I'm not the Twitter guy, but my other staff, they do that for us. We've got, I'm not sure what other events are coming, but definitely check out our website and YouTube channel as well. Again, I want to thank Dr. McNichol for being here today. For I Stand Corrected, I was really happy with your decision to come here, and look forward to using your services in the future. So any questions or concerns, please give us a call at 400 East Tarpon Avenue, located in beautiful downtown Tarpon Springs, 727-934-0844. Email is 123tthc@gmail.com. We'll answer your questions, let you know what's going on in our events. For my patients, please look for our email blast. They'll be going out pretty much every week to 10 days. And hope to see you next week at I Stand Corrected. Hope you all have a safe and wonderful week. Bye-bye.